Hello friends, welcome back to my channel Medicine of 101. Today we will talk about bacterial infections from the aspect of dermatology. Okay, so basically we'll focus today the bacterial infections from the aspect of dermatology. Okay, now see, basically we know that the bacteria they are present where within the skins. Okay, we can say the skin flora. Now within the skin, if we see everywhere, we'll see the bacteria. Now we can classify the bacteria over here in the two ways. There are some bacteria those are pathogenic, and there are some bacteria they are just known as the commensals, so they are non-pathogenic. Okay, so let's write it over here. So first we'll get the skin flora. Okay, so bacteria skin, they are regarded as skin flora. Okay, now see, we can classify these things in the two ways. I mean, in terms of the non-pathogenic and in terms of pathogenic. Now let's write it over here. Non-pathogenic, because basically they are the residents bacteria. Okay, we are within the skin, or you can say these are the commensals. Okay, and you will also get here about that the pathogenic one. So let's write it over here, the pathogenic. Now let's write down some examples. Whatever the bacteria will get in terms of the non-pathogenic, and what types of the bacteria will get in terms of the pathogenic on the skin. Now here we will get, for example, the strepto epidermidis. We can get the corynebacterium. Okay, in these cases we can get the corynebacterium. See, these bacteria basically they are non-pathogenic, okay, under normal circumstances. But if we see there is excessive proliferations of this bacteria can be pathogenic. For example, if I say, for example, with the corynebacterium, whenever we will see for the corynebacterium, the excessive proliferation at the time, what they will secrete, the keratolytic enzymes. They will secrete what under the excessive proliferations, they will secrete the keratolytic enzymes. And what they will do, they will just do the digestion of keratin. Digestion of keratin. Now see how much, if the proliferation is more over here, if we see the proliferation is more and more, then there will be more and more digestions of the keratin over here, because there will be more secretions of the keratolytic enzymes. So as a result, we will get there are more digestions of the keratin. And whatever the problem we will get whenever the digestions of the keratin will be over here, we will get the problem in the different level. Let's talk a few points about them. We can get the problem at the palm and sole level. Okay, whatever the problem we will see over here, whenever the digestions of the keratin will be in these cases, there will be formation of the pits. The multiple pits will get over here. We will get the multiple pits. This thing is known as pitted keratolysis. This thing is known as pitted keratolysis. Okay. Now we can get the problem where at the level of, for example, you can write it over here. Here. Axillary here. And whenever in these cases we will see the color of the hair, you will get the yellowish discolorations. We will get the yellowish discoloration. That means we will get the yellowish color over here in terms of the axillary hair. Okay. So let's write it over here. In these cases we will get yellowish discoloration. Okay. Now let's use the different color for it. Okay, let's use the blue one over here. Now in these cases, this is known as trichomycosis axillaris. Trichomycosis axillaris. This type of the thing we can see over here in terms of the axillary here. Okay, and we will also get the problem where at the level of axilla. Okay, and we'll get also the problem at the level of axilla. I mean, let me see in this regions over here. Okay, in this regions we'll get the non-itching, you know, the red skin rashes over here we'll get. So in the axilla we'll get over here non-itching, okay, skin rashes. We'll get the non-itching skin rash over here. Now if we see these things under the wood lamps, so if we see these things under the wood lamps, we'll get what type of thing we'll get? We'll get the red coral. We'll see a red coral shapes, just like these things. Why? Because whenever we're just doing the testings for it, we're using, because for the, you know, let me write it over here, because we'll use the coproporphyrin 3. Coproporphyrin 3 in this case we will use. This result we will get what? Red coral, red color, we can say the red coral, something over here. Okay. Now this type of the problem we'll see for what? For only one bacteria, that is the corynebacterium. Whenever we will get the excessive proliferations of the corynebacterium, they will secrete the what? You know, keratolytic enzymes. And whenever the keratolytic enzymes that will be secreted, that can cause the problem at a different level. It can cause the problem in terms of the palm and sole, where we get the multiple pits. It can cause in terms of the axillary here we'll get the uvulous discolorations of the axillary here. And in terms of the axilla, we'll get over here the non-itching skin rashes, where we'll see under the wood lamp, we're gonna get the red coral, you know, you can say the red coral color over here, because that's the for the presence of the coproporphyrin 3. In these cases we'll get. Okay, now we'll talk about in terms of the pathogenic one. Okay, so let's talk about the pathogenic one. So yes, whatever the bacteria we'll get over here. Now we'll get first bacteria, we'll get Staph aureus, and we can get, for example, Streptococcus pyogenes. Now whenever we'll get the, you know, the bacterial infections for the pathogenic bacteria, that is known as impetigo. Okay, that is known as impetigo. So I'm writing it over here in terms of the impetigo, then talk about them and results. So I'll write it over here, impetigo. So let's write it over here, impetigo. Now we will see in these cases, we will see the problem, okay, by the two categorizations. We'll get the for the non-bullous and the bullous. We'll get over here. Get the non-bullous, and you can get also from the state of the bullous. Now we'll talk about individually about the, you know, different kinds of we'll get the positive agents. We'll get the different kinds of the clinical manifestations and the different types of the treatment about them. So for that thing, I need to have a space more space. Okay, let's write it over here in this place. Okay, let's erase this part from here. And I think this place will be sufficient for explaining this part. Okay, I'm just taking this whole part to explain away. Now, whenever we are talking in terms of the impetigo, that means the pathogenic bacteria. We get the two ways. One will get the non-bullous, we get the bullous over here. Okay. Now, so whenever we are talking in terms of the non-bullous first, see, in these cases, okay, what are the positive organisms? First, if you write it over here, the positive organisms, we'll get the streptococci. Followed by the staph. But what about in these cases? In these cases, the positive organisms will get staph. Okay, in these cases, we'll get the positive agent, that will be the staph over here. Now, let's talk about the clinical manifestations. Whatever the problem we'll get. Basically, we'll get in this type of thing. Wherever we're talking in terms of the non-bolus or bolus for the emptytic over here, we'll see in case of the children, and mostly the most common affected side, that will be the face. So, we're on face. In terms of the children, for example, we are getting the lesions over here. We are getting the lesions, and around these we'll get the golden yellow. Around the lesions we'll get the golden yellow, or you can get the honey color. See, it's the erosions. We'll get the within the skins. We'll get the erosions first, and around the erosions we'll get what, the golden yellow. We'll get the golden yellow, the honey color shape over here. This is how the figure will get out. Now, what about this one in terms of the positive, in terms of the bullous things? Whatever the problem we see in these cases, we know that the step they will separate. They can separate one type of the thing, that is known as what? Okay, let's use this one over here. Now, they can secrete the exfoliative toxin. Then whenever they are secreting the exfoliative toxins, that can destroy what? Desmoglein on. And whenever the desmoglein on, that will be destroyed by the secretions of exfoliative toxins by what? The staph. Okay, here we'll see whatever the problem, we'll get the subcorneal. We'll get the problem with the subcorneal. Whatever the problem we'll see. If we see in these cases that the lesions over here, then within this case, half part of these portions will get the pus formations. So we'll get it over here, the pus collections. You get the pus collections over here. And this type of thing is known as hypopyon sign. Hypopyon sign. This positive over here, these things. Okay. So we'll get the subcorneal, and here we'll get the what? The golden yellow, the honey color. We'll get the what? The golden yellow or the honey color. Okay. Try to understand it from the aspect of the non-blush, and from the aspect of the blush we'll get what? The hypopyon signs. Okay. Now, in the same way, okay, we got it over here in terms of the what? Children face here. We'll get also where in terms of the children and on face. This type of the thing we'll see over here. Now the complications, if we talk in terms of the complications, this is the most important thing over here, that if we talk in terms of the complications. Okay. So let's talk about first this point, then this point. So I am erasing this part. Now whatever the complications we'll get. See, as far as the non-bolus, I mean the what, the streptococcus is concerned over here, whatever the the complications we'll get over here. The complications we are gonna get in these cases, the post-streptococcal glomerulonephritis in these cases, okay, and in these cases we'll get tetraise. That means staphylococcal scalded skin syndrome. Okay, we'll get in this way. So we'll get what? Staphylococcal scalded skin syndrome for what? For the bolus over here, and in case of the non-bolus, we'll get the chances for having the post-streptococcal glomerulonephritis. Okay. Now, if you talk about in terms of the treatment, if you talk in terms of the treatment, so in terms of the treatment, we can use in terms of the non-bolus over here, we can use erythromycin. Okay, we can use the erythromycin over here, and in these cases, we can use dicloxacillin. Now we can use some broad spectrum antibiotic that will cover the both in terms of the non-bolus and then bolus also. Okay, we can use over here for these things. Let's write it over in terms of the common. We can use the cephalosporin that will cover the both this and this as well. Now, moreover, we can use some topical agents. In these cases, we can use some topical agents to treat this type of problems over here. Now, as far as the topical agents is concerned, whatever the topical agents we can get over here, let's write it over here. Topical agents. Okay. Now, in terms of the topical agents, we'll get mupirocin. We can get the fusidic acid, or it is also known as sodium fusate. Sodium fusate over here, okay. And along with it, we can also use retapamulin. Okay, the name of the drugs are just like this. So you can use retapamulin. So whatever the topical agents we can use over here, in terms of the topical agents, we can use the mupirocin. Okay, mupirocin. Sorry, the mupirocin we can use the fusidic acid or the sodium fusate. We can use also the retapamulin. Okay, we can use the retapamulin over here along with these things. Now there's some complications. Originally we were getting that individual they have come over here, and we are getting the thick. We are getting the thick crushing. We are getting the thick crossing. So if we get on the skin, this system the thick crossing, at first we need to slash out this thing. So we need to remove this part. So how to remove? We can use the condensed solution. We can use the condensed compression. You can use condensed compression. What is condensed compression? This is nothing but the solution of the potassium permanganate. This is the solution of potassium permanganate. And we have to make sure that the dilutions that should be in terms of 1:10,000 ratio. 1:10,000 ratio. So before using, so in terms of the thick crossings, is lesions if we get on the scales. So at first we have to use the condensed compressions. Then you can just slash out this portion from the skin. Then we are going to use the topical agents over there. So and you have to make sure that the solution should be in the ratio of 1:10,000 ratios over here in terms of just for the dilutions purpose over here. Water. Okay. So that's all for bacterial infections. In the next part, we'll talk about the fungal infections, the treatment, the diagnosis, complications. Okay, in the same way. If you think this video is helpful for you guys, please do like and subscribe my channels, and don't forget to share among your friends. See you in the next video soon. Be healthy. Please take care of you guys and read very carefully.